Thank you. Dean Delaney, members of the faculty, and distinguished guests, I am honored and delighted to be with you today to celebrate our wonderful graduates. On behalf of the Graduate School, I begin by saying, congratulations, class of 2018. Our nursing school has some of the very best and brightest students at the University of Minnesota. I'd also like to salute those who have helped our graduates reach this very important milestone. Along the way, our graduates were nurtured and supported by parents and grandparents, aunts and uncles, partners and spouses, siblings and children. They were encouraged and inspired by friends and neighbors, classmates and colleagues, faculty and mentors, many of whom traveled a long distance to be here today. And some are here with us in spirit and no less proud of our graduates. Each of your journeys towards this day has been different. And as you continue the lifelong exploration of who you are and who you will become, your paths will continue to diverge and perhaps intersect. One thing you share in common, though, is the choice to pursue a career that will make an extraordinary difference in the lives of so many people. You will help complete strangers, live healthier lives. You will lead research that will influence healthcare outcomes across the nation and around the world. You will help educate patients, their families and communities about health conditions and diseases. You will advocate for patients' rights. You will speak with sensitivity and listen with humility. You will be part of or directly affect some of the most private, sacred, and profound moments in a person's life. You will be present when people are born, and you will be there when people die. The role of nurses has evolved rapidly during the past few decades, due in large part to the changing demands of our healthcare system. In addition to caring for the sick, today's nurses are tasked with a number of new responsibilities, from operating complex medical technology equipment to monitoring the regulatory landscape, from addressing healthcare policy to publishing scientific research, from speaking at public health forums to conducting virtual healthcare visits. Advanced nursing education is making it possible for nurses to be not just great caregivers, but great innovators and partners on interdisciplinary healthcare teams. Many of you will become practicing nurses in healthcare settings. Some of you will focus on research to impact patient outcomes. Others will become leaders in healthcare administration. You will work in hospitals and long-term care facilities, research and legal offices, emergency rooms and office buildings, higher education institutions, and elementary schools. Whether you choose a clinical, administrative, educational, or research path, as graduates of the University of Minnesota's highly ranked School of Nursing, you're equipped with the necessary skills and knowledge to be leaders in the field. Your ability to understand, appreciate, and empathize with individuals from cultures other than your own is equally important. As the U.S. population becomes increasingly diverse, your awareness of the elements that contribute to a person's health and well-being will significantly impact the effectiveness of patient care. diversity and inclusion are integral to academic excellence. As a recipient of the Health Professions Higher Education Excellence and Diversity Award for the third consecutive year, it is clear that our School of Nursing demonstrates an outstanding commitment to diversity and inclusion that has enriched your training and prepared you to succeed in a diverse world. Being a nurse is not without its challenges. Health inequities persist. Access to health care has improved, but too many individuals still lack health insurance. The Association of State and Territorial Directors of Nursing suggests that these challenges are real, but addressable. They suggest that addressing these challenges will require 1, daily self-reflection, respect, and humility. 2, recognizing the multiple social determinants of health. 3, capitalizing on community and family strengths. 4, providing leadership in the nursing field and advocating for health equality. And 5, partnering with others outside of nursing to create meaningful community change. I urge you to step up to these challenges while never losing sight of the reason you chose nursing in the first place. Your ability to envision, design, and deliver cutting-edge care with compassion and transform communities is what will lead to better health for all. Again, congratulations, and I wish you the very best today and in the years to come. Thank you.